In South Africa, a Labour appeal court has ordered striking health workers to return to work. Health Minister Joe Fala says the week-long strike has affected health services across the country and could have led to the deaths of 4 patients. Zola Sipetha, the General Secretary of the National Education, Health and Allied Workers Union, has rejected the claims. The law prohibits essential workers from engaging in strike action, which is detrimental to healthcare services with the risk of a loss of life. The workers have rejected the government's 4.7% wage hike offer and are demanding 10% instead. To help manage the crisis, the government has deployed military personnel to hospitals. CGTN's Renee Delcam with more from Cape Town.
I spoke to a leader of NEHAWU, the National Education, Health and Allied Workers Union, just a short while before coming on air, and he assured me that the union was definitely wanting to comply with the court order. He said that the union had been in the process since yesterday and is still in the process of informing all its members to get back to work. But he's referring to members in the healthcare sector, essential workers, cleaners, nurses, anybody deemed to be an essential worker in the healthcare sector has been instructed to get back to work, the union complying with that. Of course, if they did not, they would face a penalty of being in contempt of court and would have to face the consequences. So the union making it very clear that they want to be on the side of the law. However, they have said that non-essential workers in, for example, in agriculture, at home affairs, in the social services department, which does not include health, would be allowed to continue striking. Well, the Health Minister, Joe Pachla, has said enough. He said ordinary South Africans who depend on the public health service have suffered, they've had enough pain and frustration as a result of the strike. And he has said that if workers do not go back to work, they will face the penalties, as I just mentioned. He said that this wage strike so far has deprived people of life-saving medication, and this cannot be allowed to continue. So right now we have the situation where health sector workers getting back to work, non-essential workers still on strike. Well, the Public Services Bargaining Council has called on all parties to get back to wage talks, to return to the negotiating table. 4.7%, that is what government is offering. Workers want an increase between 10 and 12%. So the impasse still stands, and right now we don't know exactly when they're going to return to the negotiating table. We are yet to hear from both government and the union on this particular part of the strike.